We have a special guest here today at the Non-Traditional Veterinarian podcast. Many of you may even know her. We have Dr. Judy Morgan. She is very renowned and has over 40 years experience as an integrative veterinarian, acupuncturist, chiropractor, food therapist, best-selling author, international speaker, podcast host. What doesn't she do? And owner of Dr. Judy Morgan's Naturally Healthy Pets. Her goal, much like you have realized in this community, is to change the lives of pets by educating and empowering pet parents worldwide in the use of natural healing therapies and minimizing the use of chemicals, vaccinations, and poor quality processed food. She has a list of accolades that she has been recognized for over the past decade, and we are just so honored to have her here. I've admired her for many, many years, and this is just a surreal moment. And so, welcome, Dr. Judy Morgan.
Thank you very much. I'm very happy to be here.
And we are going to be touching on natural ways to help your pet, support your pet. And she's got a wealth of knowledge and information for us to discuss. And so we're going to dive right in. So 6 ways to help your pet keep your pet naturally healthy. I'm sure we'll probably go off topic, or maybe we'll even talk about more than 6 ways. But, from vaccines to natural alternatives to chemicals, species appropriate diets. We gave ourselves a time cap here because we probably could talk and talk and talk and talk. So I'll give the floor to you, Dr. Morgan.
Well, thank you very much. I think that our career goals are very much aligned. And for me, it's very wonderful to see younger veterinarians embracing this non-traditional path, because for me, it is just a huge frustration. I have spoken to a lot of more recent graduates who basically say that they're getting a bit, I call it brainwashed, but they're just getting one side of the story for how we can treat our pets. And that one side of the story, unfortunately, is greatly influenced by the big pet food companies and the big pharmaceutical companies. And so when you only hear that one side of the story, when you go in and you have a conversation with your veterinarian and you say, well, what about, and you name something natural, or you say, what about, and I don't want to feed my pet pesticides or put pesticides on them, or maybe you don't want to give your pet 15 vaccinations at one time, or you don't feel that your pet is a generic one size fits all, and maybe they have special needs or different requirements, and you want your pet to be treated as an individual. We can't fault our veterinarians who are being told in school there is one way and one way only to do this. They're not trying to be argumentative. They're not trying to tell you you're wrong. They just only have heard one side of the story. And so really, frankly, it is up to the educated pet parent to help educate those veterinarians and bring them along and let them see that maybe there are actually two sides to the story, and maybe we could consider doing things a little bit differently. So since I retired from practice and moved from New Jersey to North Carolina, I did not get a license in North Carolina. I still have my Jersey license. I have no idea why, because I have no plans to ever go back there for a lot of reasons. But I actually have to take my pets to a veterinarian. And I take my pets to a very traditional veterinarian because there aren't any holistic veterinarians near me. And frankly, if I could find one even an hour away, I don't mind doing that. But there aren't any. But I found a traditional veterinarian that I can go in and have a conversation with and say, no, I'm going to do this a little bit differently. And no, I don't. And she knows, don't talk to me about chemical pesticides. Don't talk to me about the vaccinations. You can send me all the reminders by text and email that you want to. That is absolutely fine. And I will just delete them.
Yeah.
And so, and we don't argue about it. I just quietly delete and say, yeah, that's great. They'll send another one. So you want to find somebody that you can at least work with and not get into arguments with, and just say, no, I really want to do this a different way. So she's a younger veterinarian, and I love her dearly because she knows if somebody puts on their referral form that they heard about her through me, Her whole staff knows, don't bring up those chemical pesticides. They're just going to say no. So we're not even going to waste our breath, which is amazing that we were able to find a staff who is willing to have two sides of the conversation. So that kind of brings us to, what are some of the ways we can keep our pets healthy? And what we're looking for is a longer lifespan, but also in reality, we're looking for a longer health span.
Yes.
And so that health span is, how long is my pet healthy? So the dog that I lost most recently was actually about a year and a half ago. He was a little English toy spaniel that I rescued when he was a year and a half old. And he came from a puppy mill. So he was getting just, all the vaccines and no vet care and just, really in bad shape when he came from the puppy mill, being fed, kind of the lowest of the low, dry kibble that's bought in bulk, probably stale, filled with storage mites, everything you can imagine. So when I adopted him at a year and a half old, he came with a laundry list of issues at that young age. And so when we adopt our dogs, most of them are from rough rescue situations. First thing we do is we put them on a whole food diet, because when you feed them real food and it's a high moisture diet, I'm a raw feeder, but I'm not against gently cooked, as long as it's whole human grade foods. So we did that, and just through diet, we managed to clear up all of his issues, cleared up his dry eye, cleared up his skin and ear problems, and he just thrived, and he was just this most wonderful little dog. When he was 15, he developed bladder cancer. And so, this is a little devastating because he was everybody's little angel. And, I thought, well, that's could be a life-ending diagnosis, and that could be something where we could just go into anticipatory grief and think about the loss that we are going to suffer. For me, I looked at that and just said, well, that's just one more bump in the road. It's not life-ending. It is not something that I need to cry about now. He's only 15, which, switching your mindset from, oh, he lived a good long life, he lived to 12, to he's only 15. That is a shift that we all need to make, because I see this on social media all the time. Oh, he had a good long life, he lived to 11 or 12. And I'm like, that's half a life. Like, we should be looking for much more. So with the help of a friend, because even as veterinarians, when one of our kids is diagnosed with something icky, it's really nice to, I make my protocol, but then I reached out to one of my holistic friends who's a holistic oncologist, so board certified in oncology and holistic medicine. So how cool is that?
It is very rare too.
So of course I dialed her up and said, hey, Kendra, I need some help here. Kendra Pope, she's amazing. Yes, she is. So I dialed her up and I said, this is what I've got. This is what I'm thinking of doing. Anything you want to add? And she tweaked my herb selections a little bit. And the great news is that George, all of his symptoms that where I had figured out that he had an issue, all went away. And he went back to being playful, running around with the young dogs, jumping around. Like, you would never know that this dog had anything wrong. And I wasn't about to tell him that he had anything wrong. I was like, you're great, George. Let's just rock and roll. George had, so I'm going to say that he had a long health span, even though he had cancer. Cancer doesn't have to stop us in our tracks.
Yes.
It's a warning sign that, hey, this body is out of balance. You better start doing something to pull it all back together, which is what we did. And so George lived to 17. And when he was diagnosed with his bladder cancer, he had 5 tumors in his bladder on ultrasound. 6 months before he passed, he was down to 3 tumors. Now, and they were small. And my goal was not to make the cancer disappear. My goal was to allow him to live happily with cancer, not dying from cancer, but living with cancer. And we were very successful in that. And so sometime after he turned 17, on a Thursday evening, he said, I don't think I want to eat dinner. I went, okay, that's unusual because you're a foodaholic. Friday morning, he still said, I really don't want breakfast. And I went, uh-oh. Friday afternoon, I really don't want dinner. But he was still wandering around the house, acting pretty good. Saturday morning, he said, I think I'm done. And he spent about an hour in the arms of each of the people in our house, getting loved on and being told it was okay for him to leave and that we were going to be okay. And he passed within an hour of us all finishing our time with him. But so his health span and his lifespan went 2 years past that cancer diagnosis. And literally, we had about 24 hours of, I think it's time to leave. And it was very peaceful. And one of the things that we struggle with, and I am so far off topic here, but one of the things that we struggle with as pet owners is feeling like I see this all the time. I'd rather be a day too early than a day too late with euthanasia.
Yes.
I'm not that way. I did have my first cat that I ever owned, which was as an adult. I waited a little bit too long with him, but I still don't have regrets on that. Looking back on it, I can say, yeah, maybe I should have eased him over the bridge a little bit, a few days sooner. But one of the things in working with a lot of hospice and palliative care cases that I discovered over the years is that natural death is actually a beautiful thing. And so working with Monkey's House, Senior Dog Hospice and Sanctuary, we had to set parameters. What would be the reasons that we would help a dog cross the bridge? And we came out with a very, very specific set, which was respiratory distress that we could not soothe, uncontrollable seizures that we could not get under control, or intractable pain that we were not able to control. Well, George had none of those. He was just peacefully shutting down. Mm-hmm. And to go through that process, it can be very difficult for the pet owner because if you haven't been through it, you don't really know what to expect. But I've been through it with people and I've been through it with animals. And I really kind of honor that natural death process. So for anybody who has a senior pet who is in palliative care or hospice care, I would recommend there's tons of great resources online to look at and read about and help you make those decisions. Like, how do we want to help our pets transition, whether that's through natural death or by helping them? And, think about that ahead of time, kind of plan ahead rather than kind of being caught in the moment and then maybe ending up somewhere with somebody you don't know in a cold, sterile environment that it just ends up not being good. Anyway, okay, now that I'm really
I really want to take a moment I really love that you hit on some points that aren't talked about enough. Our nervous system affecting their nervous system and your mindset, which they can sense, they can smell all of that. And so that you shifting your mindset to being that, okay, he's not going to die from cancer, but he's going to live with it. And it's not coming from this place of reactivity, which is kind of what you just alluded to on saying goodbye, is being more proactive and just, okay, how can I support him through this diagnosis rather than he is this diagnosis right now.
Yeah. So I think it's something that people don't think about enough. And we actually have a course on hospice and palliative care for dogs. And it actually has 3 different levels. One for if you just want to learn how to support your pet through this, respiratory system, digestive system, nervous system, all the different organ systems. Or if you want to become certified in hospice and palliative care, which we do have a lot of people who are like pet health coaches who want to also be able to help their patients through that. So that's available on Dr. Judy U. Okay, so back to 6 ways to keep your pets healthy, and hopefully we're preventing some of these things like cancers and these chronic diseases that we're seeing so much of.
A lot.
So I guess I'll start with first and foremost diet, because I know that is huge for you. Food is the foundation of life. And without a good foundation, you can't build a house. If you build your house on sand, it's going to wash away. We know that. So let's build a brick house on a really good foundation. And that starts with real food, not ultra processed food. So when we look at feeding ultra processed dry kibble to our pets, whether they're dogs or cats, and this is so true for kitty cats because they are carnivores and dry kibble is just absolutely the wrong thing to feed them. Um, if we start feeding them whole foods, human grade foods instead of ultra processed foods, the vitality and the health of them changes like that. I mean, it's just, I would have pet parents bring me their one of my best ones. So it's a dog who was down, a large dog, obese, lots of chronic things going on, and the dog had cancer. And the dog was down, and they brought the dog in for euthanasia, and the whole family was very weepy and very sad, and just obviously not prepared. But here we are in this situation, and I remember looking at them. It was fairly early in my holistic career, and I just remember looking at them and saying, you're really not ready for this, are you? Like, you're just not prepared to say goodbye to your dog. And they're like, if there was anything we could do to have this dog with us longer, we would do whatever you say, Doc. And I said, okay, I have a great plan. Let's get this dog off this processed food. I'm going to make a recipe. I want you to go home. I want you to go to the store. I want you to buy these ingredients. I want you to make this food for this dog. And let's see what happens. Because the dog wasn't eating well. The dog clearly wasn't feeling well, didn't want to get up, didn't want to move. And so they went to the grocery store. They bought everything. They made the food. And saw them a week later, and the dog was up moving around. The dog was eating like a champ. And they're like, oh my gosh, you saved our dog. I said, well, I didn't make the cancer go away. We still have an issue, but we are now giving the body fuel that it can use instead of eating at McDonald's every day. So they continued on with it. The dog actually ended up losing the excess weight. The dog looked really great.
A lot of inflammation.
And there's a lot of inflammation. And so they came back 3 months later. And when they came in 3 months, they had had 3 beautiful months with their dog. And the dog actually was now ready to pass to the other side. And they were actually ready. And they said to me, we are so thankful for the 3 months that we had with this dog, because we didn't think we had another minute when we came in here at the beginning. And even though we have to say goodbye and we're sad, we're so thankful that we got this extra time, and it was quality time. It wasn't, it was like my quality time with George. It wasn't this dog was suffering, but in the past 24 hours, she has really gone downhill. And I can't say that I'm an animal communicator, but I can look in the eyes of the animal and say, you're ready or you're not ready. And this dog at that point was saying, no, it's okay. And I think what the dog was doing actually was honoring what the people needed. The people needed that extra time, and the people had come to terms and were ready to be able to say goodbye. And the dog finally said, they're going to be okay. Mm-hmm. I'm okay. Mm-hmm. So that is the power of food. All of my rescue dogs, all of the dogs that have gone, there's about 200 that have gone through Monkey's House, Senior Hospice and Sanctuary, and all of the dogs that go to Monkey's House come there from a high kill shelter with a terminal diagnosis. So in order for a dog to get into Monkey's House, one, they have to have no owner, no one to care for them, and no one willing to care for them. And they have to have a terminal diagnosis. So that may be, stage 4 kidney disease. It may be heart failure. It may be 6 different kinds of cancer that they're carrying in their body. They may have all of those things going on. And the first thing we do is we put them on a whole food diet. And one dog has been at Monkey's House for 7 years.
Wow.
She's had 3 different kinds of cancer that we've dealt with. She's had all kinds of, liver disease, kidney disease, all these different things. And we just keep changing the diet to match what is going on for the dog. And I know that when you do nutritional consults, you are saying, look, we're treating this as an individual. This is not, I'm not going to give you a recipe that I give to everybody. I am going to figure out what your pet needs. So that's what we do at Monkey's House. And so it always starts with food. And, when we have things under control enough and we're, treating their heart disease or taking care of their dental disease, then we can move on to all the other steps that we need to do. But food is always the foundation. So for anyone who is still feeding fast food, who's still feeding highly processed kibble, the best thing that you can do for your pet, whether it's a dog or a cat, get some fresh whole foods into the bowl. So on our farm, we raise chickens for eggs and also for meat. And the reason I originally got 6 chickens was to have eggs for my dogs, not for us. It was eggs for the dogs. And I know eggs are really expensive and it kind of goes up and down depending on what the government's doing. But if you can get some fresh organic eggs, go find a farmer like me who has a bunch of extra eggs. Start adding those to the bowl a few times a week. Canned sardines, everybody can get those. Canned sardines and water, those are like a superfood.
Yes.
Organic blueberries, fresh greens that you steam. So spinach, collards, mustard greens, beet tops, all that kind of stuff. I mean, how many people cook beets for themselves and throw away the beet tops? Oh my gosh, those are so nutrient dense. Steam them, saute them, add them to your dog's bowl. So any kind of fresh foods that we can get in the bowl is going to make a huge difference. Obviously, the goal ideally would be to get your pets off of all of that highly processed food, aka kibble, things with synthetic vitamins in them. We want to move away from that. We want to give the body things that are naturally going to set it up for good health and healing. And that's going to be whole foods. So that would be my recommendation. And if you need help with that, I know that Dr. Diamante does consultations, and I have a ton of recipes on my website and in my cookbook. So tons of places where you can get free recipes to start playing around with, transition your pet gradually and see how they do with it. So diet is always going to be number one. Number two, let's look at vaccinations. Our pets are not one size fits all. My dogs run around in their fenced area on our farm. They go on leash walks around the perimeter of the farm. They don't see other dogs other than dogs in our family that are healthy. I don't take them to boarding, grooming, daycare. I had to learn how to groom my dogs myself because I don't want to give them a bunch of vaccines just so that they can go get a haircut and a bath. I'm perfectly capable of doing a haircut and a bath. May not be a very good haircut, but they're getting.
Well, the good news is his hair always grows back.
It always goes back, and it's funny. We used to show horses, and so when you show horses, we have miniatures all the way up to Clydesdales. When you show horses, you always body clip them, so they have to, be like almost hairless. You body clip everything and you trim that. Yeah, everything has to be gorgeous. The same if you're showing dogs. And so every spring, I would have to body clip, and especially our miniature horses, they grow hair 7 inches long. Yeah. And so, you go through them with the clippers and they kind of look like the lawnmower ran over them.
Yes.
And I've always joked and said, what's the difference between a good haircut and a bad haircut? And that's 2 weeks, because in 2 weeks, all those lines fill in, It grows out, and it looks just fine.
It's funny that you said that, because I had a horse for many, many years, but had her through vet school, and she ended up getting Cushing's, and clipping her was... Yeah, it was insane how much hair would come off of her. So I totally understand that. And then of course, because she'd have the cushion, she wouldn't shed appropriately. And so I'm out there in the Alabama heat clipping this horse, and I'm like, I don't care if she's got lines. I just need to get this hair off of her.
Yep. Yeah, my miniature horses are really good for body clipping until I get below the knees. And then they're like, the clippers are kind of vibrating on my little shin bones, and I don't like that. So usually they're body clipped with these big hairy socks. Yep. And I'm like, when the farrier comes, I always have to apologize and go, just ignore.
Yeah. It's just cosmetic. It's fine.
I'm like, nobody else ever sees them. It really doesn't matter. So the same with my dogs. I'm like, what, if your haircut's kind of bad, I don't really care. So we need to look at our pets and say, well, what vaccines do you really need? Now, if you go to boarding, grooming, daycare, they're going to have their list of requirements. My recommendation is try to find somebody who's more holistic and doesn't require 20 things for you to get in the door. And also ask, will they accept a titer, which is a blood test that tells you, hey, he's got antibodies for distemper and parvo. He's good to go. No more vaccines needed. So definitely look at titers if you haven't done that. And then, most groomers are going to require and boarding daycare are going to require distemper, parvo, rabies vaccine. Those are kind of the standards. Now we're getting more into, you have to have lepto, you have to have influenza, you have to have kennel cough. I hate the influenza vaccine, didn't even own it in my practice. Lepto, I hate that vaccine and because it's so highly reactive. And in my practice, it was forbidden to give it to a dog under about 12 pounds because, or a dachshund. Oh my goodness, they're going to have the worst reactions to those vaccines. And if your dog or cat has ever had an allergic reaction to a vaccination where they break out in hives, their face swells up, they can't breathe, they fall down, they're vomiting, they have diarrhea, any of those things, you want to make sure that that is noted in their record and they never get that vaccine again. Most traditional veterinarians will say, oh, we'll just give them a shot of Benadryl and that'll protect them from reacting. It doesn't. It does not. And if they give them a dose of steroids before they give the vaccine, well, then the immune system doesn't make a good response to the vaccine anyway. So that's kind of, like canceling out what you're doing anyway. So in my practice, it was always, if your pet has had a reaction, they never get that vaccine again. And that is one of the reasons, among many, why you do not want to give a whole bunch of vaccines at one time. Let's say you take them in and they get their distemper, hepatitis, parvovirus, leptospirosis, rabies, kennel cough, Lyme, all at the same time, and then they have a reaction. Which one did they react to? No way to know. So you want to separate them.
I also feel like you're asking the immune system to the ultimate form of multitasking.
Yeah.
At the same time.
This is where we get immune system confusion. And instead it just says, I think I'll have an autoimmune reaction instead. Yeah. I think I'll just kill off all the red blood cells. I'll just kill off all the platelets because I don't know what to do with this.
Exactly.
So you don't want, and yes, it is a pain in the butt if let's say you have a dog and you have to board your dog and the boarding kennel requires kennel cough, influenza, lepto, distemper, parvo, rabies. Guess what? You better start 6 months in advance because you're going to have to go get one vaccine, wait 3 weeks, go get the next vaccine, wait 3 weeks, go get the next vaccine, so that they're less likely to have reactions. There's great studies that are actually being printed in the veterinary journals now, hallelujah, that have looked at giving single vaccines versus multiple vaccines and the chances of having a bad reaction to the vaccines. It goes up exponentially when you give multiple vaccines at the same time, particularly for smaller dogs. If you have a Rottweiler, they're probably less likely to have a big problem, but why risk it? And I know it is painful. It's with most practices, it's going to be more expensive to bring them back multiple times. In our practice, for somebody who needed multiple vaccines, we would say, okay, you have a requirement to get all these vaccines for your pet. We are not willing to give all those vaccines at one time. You can pay for them all today. And then we're having you come back in 3 weeks for the next one. And then 3 weeks after that for the next one. And we're not going to charge you another office visit to come back. You've already paid for everything. So literally you're going to come in, you're going to, have the animal get the vaccine and you're going to go back out. You don't really even have to stop at the front desk because there's no payment. It's in your chart. It's good to go. And that made it a little more palatable for clients because they weren't being charged extra. They still had to make multiple trips back and forth to the office. But 90% of the time when we explain to clients, look, this is for your pet's well-being, and these are the reasons we're doing it, most people are like, oh, yeah. Like, I don't want my child to have all these problems. I don't want my kid to be vomiting in the car on the way home. I want this to, if I have to do all of this, then I want to, make it be the best that I can make it be. And so the other thing that we have to look at is how often are the vaccines required? Because we know that distemper, parvo, hepatitis, those may last a lifetime. Mm-hmm. Most statements now say at least 5 years. And AVMA and AHA, which are the Animal Hospital Associations and Veterinary Association, even on their websites, it says every 3 to 5 years. So we know that we can go that long. If your veterinarian is saying, no, they have to have distemper and parvo every single year, you better start questioning because that is absolutely not true. And if your groomer boarding daycare is saying, oh, they have to have distemper parvo every year, you need to print out those statements from AHA and AVMA and take them to them and say, yeah, no, it says right here, I don't need to do that. And maybe they'll require a titer. Maybe they'll require something that shows your pet is protected. That's fine. I'd much rather do a titer every single year.
Absolutely.
And then the other problem we run into is the cost of titers. And in some practices, they're very, very expensive, which I don't know what you've run into. I know you do a lot of relief work, but a veterinary friend of mine just sent me a message the other day, and she said, where are you getting rabies titers done for $100? Because Antech, one of the main labs, is charging $450 to the veterinarian for a rabies titer. And of course, they're going to mark that up. So the poor client is standing there having to pay $600 to $900.
Vaccine because they're like, it's a fraction of the cost.
Right. Oh, I can get a vaccine for $40 or you're going to charge me $500.
Yeah.
So for any veterinarians who are listening, go straight to Kansas State University.
That's who I do mine through.
Because guess where Antech is sending it? Yeah. They're sending it to Kansas State. Absolutely. They're marking it up to you, and then you're marking it up to your clients. I mean, I literally tell clients, go on Kansas State University, print out the price sheet, take it to your veterinarian and go, no, I know that this is what it costs. Like, I'm not paying that because that's crazy.
Yeah, I was very happy that I was able to get an account with Kansas State, and that's who I run mine through. It's a quick turnaround. And something I want to touch on real quick with vaccines before we move on to the other topics is, because I see this, because I do, like you alluded to, relief travel, veterinarian. I still do that time to time. And what people also don't realize, and this is where our job comes in to educate them, if your pet has to get a vaccine for whatever circumstance and they're educated on, the label says for healthy pets. Yes. I can't see how many pets are coming in with vomiting or diarrhea or skin issues or ear, like some form of inflammation. And I'm like, no, this isn't. I'll be honest with you, I don't care if they're due. We need to get the inflammation down so their immune system can be receptive to this if we feel like it's warranted.
Yeah.
It's for healthy pets. And then also, you know, it's very interesting to me, and I wish someone would do a study, and maybe Dr. Morgan, you're aware of a study that pets who live a more longevity focused lifestyle with less chemical exposures, whether in their environment or given to them, their food, their enrichment, you know, their whole environment, I feel like these animals are probably less likely to get these diseases versus the animals that we're seeing that get lepto and parvo and all of this. They probably don't have good gut health. They're probably on highly processed foods where there's already inflammation, where their blood is essentially sugar because of all the carbohydrates in there. And I feel like these pets are also being set up to not have the immune system that God gave them to fight off these diseases that they're exposed to.
Exactly. I mean, it's really interesting. I had another little dog who developed intestinal lymphosarcoma. That was a really ugly cancer. And so I went to an oncologist who was supposed to be more, not Kendra, she wasn't available then, but she was supposed to be more holistic. And so while we were there, didn't pertain to my dog at the time, but I thought, well, you know, I'm going to pick her brain. And I said, okay, so you are an oncologist. You're seeing dogs and treating them for chemo all day, every day. If a pet comes to you and they're due for their rabies vaccine and they're on chemotherapy, is it appropriate to vaccinate them? And she said, oh yeah, absolutely, no problem. And I just kind of went, oh my gosh, have you all not read the label that says to be given to healthy animals? And I'm sorry, but no animal undergoing chemotherapy is considered healthy. No. It's just, there is no way. But this is what is taught in the vet school. It's like, oh yeah, vaccines, no big deal. There's no problem with them. Give them to, it doesn't matter. You can have a patient who's diabetic, Cushingoid, hypothyroid with, you know, serious arthritis and heart disease, everything under the sun. Go ahead and vaccinate them. Give them 4 at a time. No, absolutely not. Vaccines are clearly labeled to be given to healthy animals for the prevention of. And so if your animal has a lot of chronic inflammatory diseases, they are not healthy enough to undergo vaccination. So, and that's a really tough argument for the pet owner to have. But this is where, you know, there's enough online research, enough resources that we can bring up. But there's, unfortunately, depending on where you look, there's also enough online resources that say, nah, it's fine, go ahead. And we can find that with anything, because we know that the scientific literature is very skewed as well. So that's another podcast. Okay, So vaccines, and the same for our kitty cats. Like I have 7 barn cats. They've had a rabies vaccine. They've had a distemper vaccine. They're the healthiest cats I've ever had. They're outside all the time. They're not vaccinated for leukemia. They're a closed colony. We have one friend from somewhere in the neighborhood who comes and visits quite often. He's almost part of the clouder now, but not quite. It took about 2 years of him kind of trying to sneak his way into the clouder. And now they will allow him to eat with them. But he comes to our house because he's like, oh, they're serving really good
Yeah,
raw
word's
food.
probably gotten out that this is the house to be at.
Well, it's funny because my clouder, it's 2 litters that were born at the same time. 2 stray mamas showed up together, and they do not allow newcomers. They, like, my daughter lived next door for a while, and her cat really wanted to be part of it, and he would come over and he just wanted to touch them and he just wanted to be part of it, and they were like, no, like, you're not one of us. So I don't really have to worry about a lot of stray cats showing up because they will not have it. They're pretty funny. I didn't know cats were that territorial.
They're like, we have
they
a
know
good
they
thing
have a
going
good
on
thing.
here, and we're healthy, and we want to keep it that way.
Yeah, we're going to keep it that way. So yeah, very happy cats. You're probably going to get some hate comments about, oh my gosh, she has outside cats. I have a farm. I have mice. I have to have cats.
Yes.
They were born out there. They're very happy. Healthiest cats I've ever had. Actually, we did a really interesting test. We tested the microbiome, which microbiome is a great test of what's the health of your animal. You can look inside and say, hey, we got good guys in there or we got bad guys in there.
Yes.
So I have 2 inside cats who never go outside. Also very minimally vaccinated. They're about 15 or 16 years old. And so they all eat the same exact thing. We did microbiome stool testing on all the cats. The outdoor cats have the healthiest microbiomes, no antibiotic resistant bacteria, like everything is beautiful. My indoor cats, their microbiomes are pretty skewed. And there are studies that show that over 80% of indoor cats are highly stressed because they're not getting to hunt and pounce and find their prey and, eat bugs and eat dirt and eat grass and do all the things and climb and do all the things that outdoor cats do, get their natural sunlight. And so it was very interesting to say this is actually a pretty good experiment. The only variable we had was inside versus outside, and inside cat microbiome much worse than outdoor healthy happy cat microbiome. So
it makes a huge difference.
Yeah. And not everyone can allow their cats to go outside.
Absolutely.
If you live on a busy city street, please don't send your cats outside. Yeah. It's going to get ugly. But taking them out on a leash or making them a catio would be an amazing thing to improve their health and definitely giving them. So I guess we're talking about mental stimulation, environmental health. But for indoor kitty cats, they need climbing space. Why do you think they go to the top of your refrigerator? That's what cats do. They get up high, they look down, they want to pounce. Give them that playtime. And if you use a laser pointer, that's amazing because they love to pounce and chase. But at the end, don't leave them frustrated going, where did it go? Give them something, whether you throw a freeze-dried heart or, a mouse toy, something, throw it on the ground that they can pounce on at the end and say, I win. Because if they don't ever get to win, oh my gosh, not happy. So mental stimulation, very important, and very important for our dogs as well. So they need to get outside. They need to have safari's. They need to see different things.
I'm glad you say that too, because I always tell my dog, I'm like, let's go on our safari.
Yep. So whether that's on a leash or off leash, whatever you can do for mental stimulation, like our dogs are so happy when I put them on a leash and they get to walk around the rest of the farm. And oh my gosh, there's donkey poop and horse poop and goat poop and chicken poop. And we're having so much fun. Good for their microbiome as well. So mental stimulation, that sunlight, so environmental health for them is really, really, really critical. It's a very important component that is often overlooked, particularly if you live in an apartment and you have a herding breed and you think that 2 walks morning and evening is enough to make your dog happy. It's not going to work. And I know everybody hates dog parks. Find a good dog park because a good dog park is worth its weight in gold. If you live in an area where your dog can never be off leash, make sure that your dog has a personality that's going to get along, or go to the dog park when no one else is there. But having some off-leash time, some free time. My daughter adopted an 80-pound dog. She lived in a 1-bedroom apartment. And I said, what are you doing with that dog? Because that walk in the morning and walk at night is not going to cut it. Luckily, her apartment complex had a really icky dog park. But she could find times when nobody was there and she could go let the dog be off leash and run around. So it's really critical for all of them to be able to do that. So let's talk about, while we're talking about environment, we'll talk about chemicals. So be very careful with the cleaning chemicals that you use in your house. Remember that new furniture, new carpets, they're off-gassing, they have formaldehyde preservatives, all kinds of things. Studies show that our pets, particularly the cats are much worse than dogs. They concentrate all of those chemicals. They're found in their stool, in their urine, in their skin, in their blood. And we see a lot of cancers secondary to this. So, if you're somebody who loves to burn candles, make sure that they are the highest quality, that they're not emitting VOCs. Don't use all those carpet sprays and air sprays and things.
And plugins and
the plugins, oh my gosh, they're so horrible. We have about 5 million scent receptors. Cats have something like 60 million, and dogs have 200 million. And those scent receptors are not only in the nose, they're actually on every cell in the body. So all of those things that are in the air and in our environment are getting super concentrated in our dogs and particularly in our cats. Remember, and if you're cigarette smokers, get the heck out of the house. Don't subject your pets to it, because smoke is heavy, it falls to the ground, and that's where your pets are lying all the time. And I saw so many cancers and respiratory problems, nasal cancers, lung cancers in pets in houses where people were heavy smokers. So that is really critical as well. Chemicals, flea and tick chemicals, pesticides. Our pets do not need to be fed or have chemical pesticides applied to them every month. I know that the veterinary parasitology group promotes to veterinarians that every pet, every month, all year, no matter where you live, should be given some sort of flea and tick pesticide as well as heartworm preventative. Well, heartworms don't even exist in some parts of this country. Mm-hmm. And interestingly, I was in Canada years ago in Nova Scotia doing a talk kind of like this. And there was a veterinarian in the audience, and I got to heartworm preventative, and I looked at him and I said, "Hey, do you even have heartworms here? It's kind of cold." He said, "No, we don't have heartworms here." I said, "Oh, that's cool. So you don't have to prescribe heartworm preventative?" "Oh, no, we recommend heartworm preventative every month for every dog all year round." And I looked at him and I said, "Why would you do that?" And he said, "Well, because they prevent intestinal parasites." And I gave him this look, and I said, "Have you ever heard of running a stool sample? Like, you can run stool samples twice a year. Like, that is crazy. We're going to give a pesticide just in case they pick something up, or we don't ever want them to pick something up. That's like saying, I'm going to cut off my left arm because I might develop bone cancer in it when I'm 90, so I should just get rid of it now." Like, oh my gosh. So, I kind of gave him this look like he was absolutely out of his mind. And I asked him if he'd ever heard of running stool samples, and maybe he could just recommend that twice a year. And he said, "I got to go to work." And he got up and left. And I thought, well, maybe I planted a seed. I don't know. It was a good moneymaker for the practice. The profit margin on those is pretty good. And I can't think of any other reason why you would do that. I really have a hard time believing that veterinarian really, really, truly, I mean, he probably was taught it in vet school, but I can't believe that you could truly say, in all honesty, every pet should be on a chemical preventative for intestinal parasites.
I think there are some veterinarians that just don't know better. They're just taught that, and they just don't know better.
Well, again, they know what they were taught in school, which is promoted by the pharmaceutical companies. So, and I can say with all of my rescue pets, they get a stool sample when they first come in, obviously, and some of them come, like I had one who came with whipworms, hookworms, roundworms, like the whole gamut. He had every other thing wrong with him that you can imagine as well. And the stupid me, I forgot to test him until he had been with me for like 3 months. And then I ran the test and went, oh, crap. My yard has now been seeded with whipworms, roundworms, and hookworms. And so I'm like, all right, well, everybody's been together for 3 months. Let's test everybody. Yeah. All of my healthy, happy pets no parasites
I bet it's
because
because their microbiome too.
their microbiome worked and their immune system said,
Mhm.
hey, that's a foreign invader. We're not doing that.
Yeah.
And so I did deworm him. I took care of his problem. And that's the only dog I've ever brought in that came with a big problem. And I've never, like when I run stool samples on my pets, nothing, even my barn cats, they're outside, they're catching
Yeah.
mice and voles and rabbits and whatever they're doing. Their stool samples are always negative because they have a healthy microbiome and a healthy immune system. So, rather than give chemicals that destroy the immune system, let's keep the immune system healthy. And
Yeah.
the same goes for fleas and ticks. My outdoor cats, they're down in the woods all the time looking for, water rats and things that they can find. What really bugs me is when they grab a water rat and they bring it up and turn it loose on my patio. It's like, no, we didn't really need them up here. Send them back down there. But you would think being down in the woods, these cats would
Yeah.
bring home ticks. 7 cats, I pull off 1 or 2 ticks a year. I mean, they don't taste good.
Probably, I was gonna say the ticks probably don't want to like attach them because they're like, this isn't the blood that I want to sell.
Right. Parasites will parasitize the weak.
Yes.
So I'm sure you've seen it in practice as well, but clients who have 12 cats and one of those cats is an old cat who's skinny with chronic kidney disease, their coat is unkempt, they look really rough. I call them dinosaurs. But they're, kind of these little walking skeletons.
Yeah.
And that cat will have 1,000 fleas, and then the big, fat, healthy young cats don't have a flea on them. And that's what parasites do. Parasites parasitize the weak.
Yeah.
And so it is our job to keep the immune system happy, keep those animals as healthy as possible. There's a great YouTube video. I may have it attached in my heartworm article, but it's a YouTube video where somebody set up a microscope and they have a microfilaria, which is basically a baby heartworm swimming around in the blood. And it's a time lapse over about 48 hours. And over that 48 hours, the white blood cells come in and they latch onto this thing, this parasite, and they literally eat it. And it is destroyed. This is the immune system at work. So if your dog or cat gets exposed to something like heartworms, the immune system says, there's a foreign invader. We better go get it. And it does if it's healthy and it has a proper response. And unfortunately, so many of our animals can't make a proper immune response because they have chronic inflammatory disease and a bad microbiome and everything else that's going on. So your goal is don't throw more chemicals at them. Would we give our kids a pesticide to eat and say, well, now we don't have to worry about you getting lice at school?
Yeah, exactly.
I don't think so.
Exactly.
I don't think so. Like you would think your pediatrician was nuts.
Exactly. And I think that we forget that, I'll see pets come in for a little abrasion and I'm like, we forget they have an immune system that they don't need. Sometimes we have to step in and help them. And I like to say there's more than one way to cook an egg. So we can support them. You can either do it traditionally, conventionally, integratively, holistically. There's so many different ways, but we forget that they were given an immune system to let their skin heal from the abrasion or the bite or whatever it is, or the diarrhea that they're having. Like their bodies are designed to help rid these things.
Yes.
So the first time they cough, they sneeze, their stool is abnormal. We don't need to rush and intervene. And I'm not saying that you don't take them to the vet and be seen, but I think sometimes we forget, and the first thought is to just prescribe rather than, okay, how can I support this pet so their immune system can do what it was designed to do?
Exactly. And there are so many things we can do naturally. If your pet has an upset stomach, they've got some vomiting, they've got some mucus in the stool, diarrhea. And I'm so happy that I have seen in the veterinary journals now where they're saying, hey, let's not give antibiotics when they have bloody diarrhea.
Lord.
Hey, metronidazole is actually causing more problems than it's fixing.
And there are doctors out there with any stool issue that are still prescribing at the drop of a hat.
Metronidazole, right and left.
Read the articles that show this.
So for pet owners who have pets with GI upsets and vomiting, if they're vomiting uncontrollably, you might have to intervene because you can't give them anything orally if they can't hold it down. It's just not going to work. But for stool issues, slippery elm, marshmallow root, a bland diet, probiotics, a little bit of fiber can go so far to getting these problems solved without resorting to drugs and chemicals. And the studies are showing that when we treat from that natural route, the microbiome fixes itself and is back to normal in 48 hours versus we give something like metronidazole, it's going
At
to be
least
30
years.
plus days.
Yeah. Well, and then the microbiome can be affected for years and years and
Yep.
years down. It's
Yep.
not just that time period where we give the antibiotic.
Yep. So really, really important to, do your research. And, this is why I write books. I'm working on book number 10, but the books, the blogs, everything that's the courses, everything that's on our website is to help pet owners navigate this stuff and know that there are alternative ways to approach these things. And maybe we don't have to run for chemicals and antibiotics and non-steroidal anti-inflammatories. Maybe there are a lot of other ways that we can calm things down in the body. And so to finish out my 6 ways, grooming, go over your pet every single day, because that's when you're going to see bumps, bruises, scrapes, cuts, new lumps, things that you might want to have checked. It'll alert you to, a pet who's over grooming and pulling hair out of an area, or under grooming and they've got clumpy, matty hair. Look inside the ears, look at the teeth. Dental care, extremely important. Again, another podcast. So that daily body check, we can lump it under grooming, but it's really just kind of going over them every day and, have them roll over, give them a belly rub and look and see, are there any new lumps and bumps there? Does anything look weird down there? It's important to just know what's normal. And don't forget, particularly on cats, look at their feet. One of my my indoor cats walked across the room the other day and I'm like, why is she leaving little spots of blood? I rarely look at my cat's feet, bad on me. And she had an ingrown toenail. I'm like, oh my gosh, you're suffering with an ingrown toenail to the point where your pad is bleeding. What a bad mama am I? So everybody got a nail trim. So, don't neglect those things. We think that our cats shed their nails with their scratching, but as they get older, particularly the teenagers, they don't always do that very well. So really critical. And I am a big fan of proactive veterinary care, including lab work. I'm a lab work junkie. Like, I want to know what's going on with the kidneys and the liver. And I want to see the inside of that animal. So I love especially our seniors, anytime after 7, twice a year, even our youngsters once a year, like even my 1-year-olds go in and they get lab work. It's amazing. Like, we would do preoperative lab work for a spay or a neuter in a, 18-month-old animal. And a couple of them were like, oh my gosh, they're in kidney failure. What is going on? And, it's like, well, that's a wake-up call. They're acting perfectly normal. They're only 18 months old. Why would they have kidney failure? And then you find out, oh, they have polycystic kidneys. Didn't know that. They weren't showing us any signs. So that's why I like to start early. Proactive veterinary care for me is go in, have your veterinarian do a full exam, because you can't listen to the heart. I mean, maybe if you're a doctor or a nurse, you might know what you're listening to, but most people don't. They can palpate the abdomen. They can say, oh, the kidneys are small and lumpy, or we have an enlarged organ, or, oh, there's something extra in here. This doesn't feel good, or they're painful when I do this. Looking deep in their ear canals, looking at their retinas with the ophthalmoscope, like all those things that we can't do at home. Your veterinarian is trained to do that, and they are the best person to do that. So I like to have that full physical exam. And then I'm, like I said, I'm a lab work junkie, but that doesn't mean every time I take my animals in, when they say, oh, are you using heartworm preventative and flea and tick preventative? My answer is no. I'm working on their immune system. Thank you.
Yeah.
And so I can say no to that. And when they say, well, we recommend this list of vaccines, I can say no to that and feel very comfortable, because I know what my particular pet needs. And so my recommendation is for every owner to educate yourself about what your particular animal needs. Do you travel with them? Where do you go with them? Do they go to boarding, grooming, daycare? Or do they stay home? Are they a home buddy? Are you somebody who is going to all the shelter walks? Are you, who is your pet around? Do you have an indoor cat who is never going to see the light of outside? That's a very different story.
Yes.
Although in my world, it's not even that different. My outdoor cats don't get any more vaccines than my indoor cats. But again, they're a closed colony in a healthy environment. So you have to look at your individual pet. So, going in for that veterinary checkup, as long as you are educated and armed with your knowledge, you can go in and politely say, no, I'm doing it this way. And there, like I said, there are a lot of resources out there that if you need them, you can arm yourself with and say, no, here, this is what this says, and this is why. Or, no, I prefer to use natural flea and tick chemicals. I'm really worried about the neurologic side effects from those chemicals. I don't want to use those on my pet. So, forewarned, forearmed, and just be able to have good, productive conversations with your veterinarian rather than arguments.
Absolutely. And I say it all the time to my clients is that let's get data so that we can make decisions and we're making intentional, informed decisions because no two pets are the same. And so
Exactly.
the more data we can have, the more decisions we can make, and the faster we can make those decisions and not being reactive, but being proactive about it so that we have it all rather than now we're, like we alluded to at the beginning of this conversation, now we're being reactive and you're coming from a place of scarcity and hustle and nothing good ever happens.
Yeah.
We're in that state. So Dr. Moore, as we wrap up, we let people know where they can find you, and I'll make sure it is in all, whether they're watching this on YouTube or listening on Spotify or Apple, have it all linked, but where can they find you and all your wealth of knowledge?
Our website is naturallyhealthypets.com. And from there, you can get to Dr. Judy U, which is where all of our courses are posted. The courses are, some are offered by me, some are offered by other holistic veterinarians, people in the holistic pet space. Our books are on Amazon, pretty much anywhere you buy books. And we do have a 50% off code for people who want to buy any of my books that I've written on naturallyhealthypets.com. So we'll give that to you, and you can put that in your show notes as well.
Absolutely. Well, thank you so much for being here. Your wealth of knowledge, you are an inspiration for so many of us that are finding this path and feel aligned with it. And to see someone who's paved the way and feel so confident and aligned, it just helps so many of us. So thank you for being here.
Thank you.